if you start a new food, we should at least try to give it at least once a week so we don't get a resensitization. I mean, that's what I was told by many allergists. Do you agree with that concept?
Yes, I do agree with that. For a 4-month-old, you should start with rice cereal. It's the least allergic. Begin with about a half a teaspoon and work your way to 1 to 2 teaspoons 2 to 3 times a day.
When you make rice cereal, is there any kind of way you should do it better than any way? First, would it be better in a dish, not in the bottle?
In a dish and spoon feeding it to a child, you're working their oral motor skills. At about 4 months of age, they should have good oral motor skills. And you're not really giving it for nutrition, you're really giving it for the pleasure of eating and for the oral motor skills.
Sometimes parents think they should put it in a bottle. We do that sometimes for reflux. This is for feeding technique, so they should not mix up the two concepts. That's right?
Well, I don't see any harm to putting it in the bottle. But again, when you give it by mouth, you're working on...
You're developing a certain new
skill.
Thing in the child's life, and
Right.
the skill.
Right.
Okay. Now, you mentioned rice cereal. Yeah, I hear people trying to start other cereals. Is there a reason why you pick rice over barley and oatmeal?
Yes. Rice is the least allergenic. Barley, let's say you had celiac disease. People with celiac disease are allergic to barley. They may also be allergic to oats because of the cross-contamination of oats with wheat. So rice is the least allergic. Also, you have the most starch enzymes in the gut at 4 months of age to digest rice.
So it's easy to digest. There's less chance of having some sensitization to things like gluten at that age by avoiding it in the diet.
Yes.
And there's some concept that if you give gluten later, you may have less problems in life. We don't know for sure, but there's some people who feel that.
Right, right. If you feel if the child appears with blood in the stool when exposed to wheat, it would be a good idea not to continue exposing them, because that could be an allergen.
If the previous sibling had a lot of difficulty with food, does that mean your next child will have problems with the food?
No, each child is different, and each child has a different set of things that they may or may not be allergic to.
But we have that.
The risk might be
higher.
higher.
A little higher, but
Risk
it's the back
might
of
be
our
higher,
head.
yeah.
Okay, once you get the rice cereal going in the child for a week or two, would you progress to anything else?
At about 5 months of age, you'd start working on pureed and strained peas, carrots, squash. The reason we start with vegetables first is probably because they're less allergic, and also the fruits have a better taste. If you start the fruits first, they may not want to go
So
to
you're actually
trying
getting
vegetables.
that. You want to keep that sugary concept away, because that could lead to obesity down the road if they get that craving for sugar.
After about 2 weeks, you could add in applesauce, bananas, peaches, and pears. It would be about a 2-ounce jar divided 3 times in one day. So if the child's about 5 months old, you might use a 2-ounce jar and divide it 3 times. And like we said before, you might want to repeat that the next day and the next day, just to make sure that they're tolerant.
So the concept is about 3 days, one new food at a time,
Yes.
not 2. The old food can still, is safe, be used the same time.